Good nutrition is important for diabetics. It is important that we all follow a healthy, well-balanced diet in order to have long, healthy lives. For diabetics, a healthy diet is even more important than it is for others. More than 23 million Americans suffer from diabetes, and millions more may be at risk of developing the disease, or may even have it and not realize it. There are 3 types of diabetes: type 1 or juvenile diabetes, about 5 to 10% of all cases, type 2 diabetes, which is the most common, and seen in approximately 95% of all cases of diabetes, and gestational diabetes. What is diabetes? Diabetes is a condition that causes patients to have high blood glucose levels, and, often, this must be controlled through medications such as insulin and, of course, a healthy diet. Diabetes is a serious condition, and left untreated, it can lead to a number of other health issues, including heart disease, kidney disease and even kidney failure. Many people end up with eye diseases and are at risk of blindness due to their diabetes, and it can even cause impotency in some men. There are many risk factors for developing diabetes, including being a member of a high-risk group, Hispanic, Aboriginal, Asian and African in particular, being overweight, having a family history of diabetes, having other health issues that are associated with diabetes, giving birth to a baby weighing more than 9 pounds, having gestational diabetes, diabetes that develops during pregnancy, although in most cases it goes away after the baby is born, having high blood pressure, having high cholesterol levels. Anyone who has one or more of the above risk factors, and has not been tested for diabetes, should be tested. Early detection is one of the best ways to treat this disease, and it may even be that the person being tested does not have diabetes at all, which obviously is a real relief. There are many symptoms that diabetics face with their condition. Some of these symptoms include excessive thirst, excessive hunger, frequent urination, sudden weight gain or loss, extreme fatigue, frequent and recurring infections, poor or blurred vision, impotency, tingling or numbness in the hands and or feet, cuts and bruises that do not heal quickly. Dietary sources of protein that are excellent for diabetic diets. One of the first things that a person must do when diagnosed with diabetes is make some lifestyle changes. In addition to getting more exercise and taking the prescribed medication, diabetics must follow a diet that has the nutrients they need to help fight the disease. Having a poor diet will cause any number of health conditions, and will make existing conditions, including diabetes, that much worse. There are 2 types of dietary sources of protein: animal proteins and plant proteins. Animal proteins are complete proteins, and some excellent choices for diabetic diets include fish, white meat, poultry, low-fat dairy products such as milk and cheese, and eggs, which are known as a perfect protein. Plant proteins are incomplete proteins, with the exception of soy, which is not only great for diabetics, but is also known to help prevent breast cancer in women. Some plant proteins that are recommended for diabetic diets include broccoli, legumes, leafy greens such as spinach, whole grains, and brown rice, just to name a few. Protein supplements can help diabetics get the nutrients they need. Many diabetics who are not getting the right amount of protein as well as other nutrients and vitamins in their diets are often told by their physicians that they should use protein supplements. This is a great way to get all of the protein needed each day, and for those who are overweight, which causes and is caused by diabetes, protein supplements make excellent, healthy meal replacements. There are many different sources of protein that are used in supplements, including whey, casein, soy, rice, and egg. Soy is great for vegetarians, as it is the only plant-based protein that is complete, meaning that it contains all 8 essential amino acids and all 14 non-essential amino acids. Essential amino acids, these are amino acids that must come from dietary sources, as the body is unable to produce them on its own. The 8 essential amino acids are leucine, isoleucine, lysine, threonine, tryptophan, valine, methionine, and phenylalanine. Non-essential amino acids, these are the amino acids that the body is able to produce by itself. The 14 non-essential amino acids are alanine, arginine, asparagine, aspartic acid, cysteine, cysteine, proline, serine, taurine, glutamine, tyrosine, ornithine, glutamic acid, and glycine. There are many different types of protein supplements available today, and each is great for what it is meant for. A physician will likely recommend a specific type of protein supplements for diabetic patients, depending on the nutritional needs of each individual patient. Some of the more popular types of protein supplements include liquid protein supplements, protein powders and liquid protein shots. Liquid protein supplements, these are popular because they're so convenient. Liquid protein supplements often come in pre-mixed drinks, so they make terrific meal replacements that can be taken anywhere, ideal for those who are too busy to have a sit-down meal. Protein powders, these are the most versatile types of protein supplements. Protein powders are available unflavored, so they can be added to pretty much any recipe you can think of, even desserts. One of the best protein powders to use as a food additive is rice, because it is virtually flavorless to begin with. Many people, diabetics included, also like the flavored protein powders, because they can be used to make meal replacement shakes and smoothies that are not only healthy for diabetic diets, but tasty too. Liquid protein shots. This is a form of protein supplement that is becoming increasingly popular, especially with diabetics. Liquid protein shots are often low in calories and do not have many, if any, carbohydrates or fats, which make them great for low-calorie diets used by diabetics, as well as those who are trying to lose weight. One of the more popular liquid protein shots is ProfectR by Protica because it provides 25 grams of protein per 2.9 fluid ounce serving but only has 100 calories. Each serving of ProfectR provides 100% of the recommended daily amount of vitamin C, as well as half of the B-complex vitamins and many other nutrients. ProfectR has no fat or carbohydrates and comes in many delicious flavors, including grapefruit mango, orange pineapple, and blue raspberry. Whether it is due to diabetes, or just to start eating healthier, everyone who is thinking about making changes to their diets, and using dietary supplements, should check with their physician first. Diabetics will need to have supplements that provide the right nutrients, including protein, while making sure that they are low in fat, calories, and carbohydrates.